Basically, as COVID-19 spread in March, the demand for PPE grew by a factor of 100 and prices skyrocketed. And so a global shortage of gloves, masks, and eye protection obviously affected all health workers. But it quickly became apparent to the Community Health Impact Coalition back in March that the brunt of this shortage was falling on low and middle income countries and community health workers in particular. Not only was there an absolute shortage, but there was a major distributional problem as well. We saw in country after country that CHWs were being excluded from national PPE projections, despite the life-saving work that they undertake. And this is having devastating consequences. While we know that everyone is quote unquote over hearing about COVID, COVID is unfortunately far from over. As you can see in the animation running on the screen behind me, cases in Africa continue to rise by 6% every single day. We are mid-emergency. Community health workers are, meanwhile, at the front lines preventing, detecting, and responding to this outbreak. Yet, without PPE, they put themselves and their patients at risk. In every country, and I want to make this clear, in every country covered by the fund, all 24 countries, CHWs are relied on for services as diverse as malaria testing, providing vaccinations, malnutrition case management, case finding, home-based care for COVID patients. And this is the critical part. None of what I just mentioned, none of these services can be done over the phone from 6 feet away or with only a homemade mask. And it's reductions in precisely these types of services that often kill more than the pandemic itself. We saw that during Ebola, and we're already unfortunately seeing this now due to the lack of PPE for frontline workers. Moreover, CHWs go house to house. So without PPE, they risk becoming disease vectors themselves. And we've already seen, again, following the drop in access to protective gear on the continent, there was a 203% increase in COVID-19 infections among healthcare workers. And this is in the context, of course, of an already acute health worker shortage. Meanwhile, the evidence couldn't be clearer. A recent JAMA article, the first study actually looking at PPE for CHWs in COVID, found that without complete PPE, nearly 1 out of every 5 CHWs were infected with COVID. With complete PPE, so a mask, gloves, face shields, none, 0% were infected whilst carrying out their door-to-door duties. If we had a drug that worked that well, we'd be sending it to every health worker on Earth. Yet, in communities around the globe, CHWs, who are the face of essential services, are still going without this essential tool to continue their work in providing essential services. I'm going to tell it to you straight. The unequal distribution of PPE, we think, reflects the existing biases about the worth of the life-saving work that CHWs do, and it needs to be corrected. There needs to be a preferential option to correct it, and that's what we tried to develop here. PPE, from an epidemiological standpoint, very clearly should be distributed based on the services provided, not on the service provider. And that's what we all got together here to correct. So to address this problem, this amazing team worked with countries to scope and actually quantify PPE needs for CHWs providing essential health services in 24 African countries. And basically, as Muhsin shared, everything that this fund is doing is 100% evidence-based, verified with ministries of health, and based on these verified projections. And our rapid analysis, and you can see that on the screen here now, found that the need for PPE was immense. Over 400 million pieces of PPE were needed to protect these workers, to maintain the essential health services that, again, so often get disrupted during pandemics and are at risk of being disrupted literally as we're speaking to you now. But to respond to this crisis, we did what so many of the organizations involved, and as Muhsin mentioned, there are over 30, plus all of our Ministry of Health partners. We put in place a plan to both meet this acute need, because again, we're in a crisis, even though it might not feel like it, we are absolutely in a crisis. You saw that case rate climbing, while at the same time building health systems for the long term. How can, at this moment, we use PPE as a wedge to further institutionalize community health workers within ministries of health and within health systems across the globe?